All right, so good afternoon, everybody. I hope you enjoyed your lunch. My name's Noah Hale. I'm the Forest Safety Manager on the Ottawa National Forest. I was asked to give a presentation I gave the other day, asked to give the same presentation here. My presentation is pretty much on what the strategic risk mitigating factors are for our agency and how I apply them on my forest and advise my forest supervisor to create an operational risk management risk assessment so that we can hand that to our employees and it'll help them develop further mitigate risks in their programs and in the field operations and help them in making their decisions on how they're going to implement and conduct their daily activities. The important thing about my force being able to hand this operational risk assessment out is it provides the minimum guidance that my forest supervisor wants. And as the programs start to further mitigate risk internal to their own programs, if they've identified an issue that we've overlooked, they can raise it back up to us and we can readjust our operational risk assessment if it applies to everybody, or we can provide them the resources they need to accept the risk that they're willing to accept. So the first thing I'm going to start off with, let me share this. Let me know when y'all can see that.
It's up. Yep.
All right.
It's up.
So the first thing I want to start off with is risk management at the enterprise and the strategic level here in the Forest Service. What is it? Enterprise and strategically, because the Forest Service said we're going to abide by CDC and OSHA guidelines, our strategic planning is OSHA and CDC guidelines. So it's important to understand what those guidelines are. And I started off with first OSHA in my risk assessment flow here. Occupational exposure to COVID-19 virus in an OSHA-defined risk exposure level of medium is approved. All right. So OSHA has defined we would fit into their medium level, and we fit into the medium level because we cannot always maintain 6 foot of social distancing. That's really the determining factor between low and medium. Is in our environment, we can't always guarantee that we can maintain 6 feet social distancing. So do we meet the OSHA rules, or have we been approved by the supervisor? Has he accepted our employees to work at the medium level? If the answer is no, he's not accepting that risk, boom, we can't do any work. Now, if my forest supervisor is willing to accept that risk, in accordance with OSHA, we need to conduct our daily work activities in accordance with risk mitigating factors established for the current local community transmission level of none to minimal, minimal to moderate, or substantial for the workplaces as referenced in the implementation of mitigation strategies for communities with local COVID-19 transmission. Okay, so I'm now approved to work in our medium OSHA environment, and OSHA is telling me to conduct that work based off of my level of local community spread. Now, in accordance with CDC guidelines, the CDC says, has the person been directly exposed to a person with symptomatic COVID-19 during the period of 48 hours until the person meets the criteria for discontinuing home isolation? So basically what they're saying is CDC is telling us if you have, as an employee, if you have been directly exposed to a COVID patient, a known COVID patient, that you now need to go home. If you have been exposed, you now need to go home for 14 days. If you have not been exposed directly to a known COVID patient, the CDC is telling us that our employees and everybody else in the country, employee has possible unrecognized COVID-19 exposures in a U.S. community, and the employee will self-monitor for symptoms, will social distance, and will practice in accordance with local community transmission levels. The employee will follow CDC guidance if symptoms develop. So again, we're approved to work with OSHA. According to CDC, we're one of two things. We've either been exposed to a known COVID patient, therefore we go home for 14 days. If we have not been exposed to a known COVID patient, then we recognize that we're working in an unrecognized COVID-19 environment and that we need to self-monitor and mitigate risks. When you're working in an unrecognized COVID environment, you have to operate within those 3 levels of local community spread. So what are those local community spreads? If you are a none to minimal, our organization is expected that all employees know where to find local information on COVID-19 and local trends of COVID cases, know the signs and symptoms of COVID-19, and what to do if a staff becomes symptomatic at the worksite. Review, update, and develop workplace plans to include liberal leave and telework policies. Consider 7-day leave policies for people with COVID-19 symptoms. Consider alternate team approaches for work schedules. Encourage employees to stay home and notify workplace administrators when they're sick. Encourage employees to stay home and notify workplace, correction, I stated that again. Encourage personal protective measures among staff. Clean and disinfect frequently touched surfaces daily. Ensure good hand hygiene supplies are readily available. Now that's for the none to minimal. Once we have a local community spread level of minimal to moderate, we have to meet the none to minimal guidelines, and we have to also meet now the minimal to moderate. So we're going to add on to that, encourage staff to telework, particularly individuals at increased risk of illness. We're going to implement social distancing measures by increasing physical space between workers at the worksite, staggering work schedules, decreasing social contacts in the workplace. We're going to limit large work-related gatherings. We're going to limit non-essential work travel. We're going to consider regular health checks of staff and advisor, and those health checks could be administrative. They could be taking the temperature, things of that nature, in accordance with the strategic guidance. Now, the next level that we will be operating at will be the highest level, will be your substantial level. Not only do you have to meet the minimal to none to minimal and minimal to moderate, but now you also have to implement extended telework agreements, ensure flexible leave policies for staff, and cancel non-essential work travel, cancel work-sponsored conferences, trade shows, etc. That right there is almost word for word is our enterprise and strategic level risk mitigation procedures. So I look at this and say, now how do I further mitigate this down on the forest side, and so that my forest supervisor can provide what he's willing to accept, so that we can push it down to the unit so they can further develop among themselves and mitigate risks in accordance with their environments, their tasks, and all their variables among the unit or among the program. So the driving factor in this, on the strategic level, risk mitigation only takes place in your level of community spread. That's where all the risk mitigation takes place. So it's taking place in a substantial level community spread. It'll take place in a minimum to moderate community spread and in a none to minimal. So I transposed that over and I said, oh, I'm going to need 3 different operational risk assessments. I'm going to need one for the none to minimal community spread level. I'm going to need one for the minimal to moderate, and I'm going to need one for the substantial level. Substantial being the most restrictive, and substantial being what we're currently in on my forest right now. So I'm going to bring up these risk assessments. These are not approved. We're developing these, and I'm working and advising the forest supervisor on on the final product. We expected the new risk assessments to come out very soon. Now, in developing these risk assessments, I had to go line by line for the strategic strategy. So the first thing I have to do, according to OSHA, we are working in a medium environment. So the task here is working in the forest with the occupational exposure of a OSHA-defined medium level, which means the hazard is we are going to operate at some point within 6 feet. We're expected to operate at some point within 6 feet of our personnel. The initial risk on this, because the hazard probability is frequently and the severity is catastrophic, the initial risk level on this would be critical. How do I mitigate risk on this OSHA defined medium level? Well, in accordance with OSHA, we're going to conduct daily work activities in accordance with risk mitigating factors established in the local community transmission level of none to minimal. So as long as we institute those risk mitigation factors, we can take this hazard, and at our level, I've determined that the probability is occasional, the severity is catastrophic, and it leaves us with the final risk level of serious. Oops. Now going down to the next hazard. That was the OSHA intent. Now, not only do we deal with OSHA, but now CDC says, has the employee been exposed directly to a patient, a known COVID patient? All right, at the minimal to none to minimal community spread level, that will occasionally happen. The consequence of severity can be catastrophic, so the initial risk is serious. Well, what do we do how do we mitigate and how do we abate the person who was exposed? If the employee was exposed in accordance with CDC to a known patient, we send them home for 14 days. Didn't really mitigate the hazard probability or the severity, but it is an abatement action, especially on preventing further exposure to employees. So that still remains the residual is the same as the initial instead of serious. The next question we had, still in CDC guidance, is if the person has not been exposed to a known COVID patient and we don't have to send them home, now CDC is acknowledging that every single person in the US operates under a hazard of possible unrecognized COVID exposure in the US. So the US and our strategic and enterprise risk management has acknowledged that everybody is exposed potentially to COVID. They're acknowledging that. So in the none to minimal community spread level, I've determined that and this is working with the supervisors and my program managers to develop this, we've determined the initial, the probability is rarely, the severity is catastrophic, so our initial is moderate. Employee, how do we mitigate that risk of operating in an unrecognized environment? The employee will self-monitor for symptoms. Social distancing will be practiced in accordance with local community transmission levels. Employee will follow CDC guidance if symptoms develop, and that's directly from CDC. We've mitigated that down to a moderate, not really down, it's the same as the initial. So once again, earlier I said with the strategic and enterprise risk management, the risk mitigating factors take place at the local community spread level. So we've gone through OSHA, we've gone through CDC, now we have to determine the required risk mitigating factors for none to minimal local community spread. So in this case, if you go back to the ORM flow sheet, they tell you what your required risk mitigating factors are. So now I'm working with the program managers, working with the strategic guidance that Forest Service has brought out. We said, let's make this specific to the Ottawa National Forest, ensuring that it's in cohesion with and in the confines of the strategic risk assessment, but let's mitigate it a little bit more down to our end so that we can give guidance to the rest of our employees to further mitigate within their programs and functions. So for a local community spread of none to minimum, the required forest supervisor is stating to our employees, the forest safety manager will monitor the Michigan Department of Health and Human Services website for current community transmission level and trends so that we know when we can switch between levels. Supervisors will ensure that their employees know the signs and symptoms of COVID-19 and what to do if they become symptomatic at the workplace. Employees will familiarize themselves with the information in Self-Checker app published on the CDC website. Websites provided. All administrative buildings and offices will have CDC flyers, Stop the Spread of Germs and Symptoms of Coronavirus Disease, posted in conspicuous places throughout the building. Telework, leave, overtime, comp time, and credit hours for the Corona Disease 2019 will be in accordance with current OPM regulations and USDA guidance. These regulations and guidances are intended to identify HR flexibilities to help minimize risk to employees and their families, as well as ensure the readiness of their employees to continue to execute mission of the agency. More comprehensive guidance can be found at these following websites. All employees are encouraged to notify their supervisor and stay at home when they are sick. All employees are encouraged to practice good hygiene, to include hand washing and respiratory etiquette in accordance with guidelines established by the CDC website. All employees will clean and disinfect their frequently touched surfaces daily. Program managers, supervisors, and team leaders will ensure hand hygiene supplies are readily available for proper hand washing. Continuing on, staff will keep open lines of communication between their supervisors and subordinates and will route all recommendations, concerns, or safety hazards using one of the many sources available. Program managers, supervisors, and employees will apply these forest operational risk mitigation procedures to their operations and daily activities in a way to ensure full compliance. Now, if you take those risk mitigating strategies, do we meet, based off all those that I just wrote for our forest, do we meet the strategic level for none to minimum? Absolutely. If you compare ours to this one, what we did is we just took their broad guidance, we drilled it down a little bit more for the specific, and then we're going to hand that for the specific force, and then we're going to hand that to our programs and employees and say, you are further cleared to mitigate risk as long as you stay in the confines of the forest supervisor's accepted risk. Now going to the minimal to moderate. When you start bouncing from none to minimal, minimal to moderate, and then to substantial, there's really only a couple things that take place because we've already acknowledged we operate in an unrecognized COVID environment. So when you jump between the levels, the only thing that's happening really is you're focusing more on social distancing and you're focusing more on cleanliness and disinfecting. That's really the difference between these three levels. Social distancing isn't just making sure everybody has 6 foot separation. It could be enforcing more telework to keep people out of the offices and the workspaces. It could be measures of making one person per vehicle, or making people wear masks when there's multiple people in the vehicles, and then also just making sure that we influence personal hygiene. If you notice, when it comes to the community spread, when it comes to the isolation, maintaining your social distancing and maintaining your personal hygiene, your hand washing, most of that responsibility is placed on the employee. But the manager can enact stricter guidelines by saying, hey, we're going to have you go home or whatever. So at the medium level, or go home and telework, at the medium level, the OSHA level remains the same. That one applies to every single level. The CDC, if you've been exposed, is the same. It applies to every level. And then if you haven't been exposed, we recognize that you're operating in COVID. That remains the same throughout all three levels of risk mitigation. However, when it comes down to the mitigation strategy for the current level we're in, it gets a little bit more in depth and a little bit longer and stricter. So in our case, number 1, number 2, number 3, number 4, this top block remains the same as the original lower level. We go down to the next line, and this is where we started further mitigating risk for the middle level. Line officers, program managers will encourage telework to the fullest extent possible. We added that for this level, while ensuring all mission critical regional priorities and forest priorities are effectively supported. Particular attention to employees and to their family members with increased risk of severe illness should be considered when implementing telework assignments. Employees will maintain social distancing to the maximum extent possible. Line officers, program managers, and supervisors will assist and support the maximization of social distancing by anticipating for the decrease in productivity brought about by implementing social distancing, staggering, and/or adjusting work schedules, limiting in-person meetings to 10 people, increasing the use of virtual telephonic meetings, limiting social gatherings to less than 10 people, and accepting only necessary risk in relation to social distancing. Line officers are encouraged all customers to schedule meetings and establish screening procedures. Examples would be administrative, temperature, or respiratory symptom screening of staff and visitors entering the building. It is recommended that all employees wear fabric or cloth masks. Supervisors will limit non-essential work travel. The PAO will ensure that the public remains aware of all current operational procedures and will publish these notices in accordance with normal procedures. Program managers will start reporting and identifying program impacts due to the current level of community spread, and will start estimating future impacts and limitations for continuous operations at the current level and impacts and limitations if the level increases to substantial. Staff will keep open lines of communication between their supervisors, and program managers, supervisors, employees will implement these risk mitigating procedures into their daily activities in a way to ensure full compliance. So once again, if you look at those risk mitigating factors and you go back to the flow chart, we are meeting the strategic and the enterprise risk mitigating factors required of us. Yet, we didn't make it so strict. We're meeting it, but we didn't make it so strict that we don't allow the program managers, the supervisors, and the employees to adjust the risk assessment to mitigate in accordance with their variables, their experience, their environment, their resources that they have. Now, going up to the substantial level, this is the one that we're currently operating in right now. Again, that the first three blocks are going to remain the same because they are specific to the OSHA and the CDC. Have you been exposed or are you working in a unrecognized environment? Where the moneymaker is for us, where the risk mitigating factors take place, again, is in the level of community spread. In our case, we're at the highest level of community spread. We started out the low one, it was pretty lax. We went to the middle one, we got a little bit more stricter on cleaning and social distancing, and now we're in the substantial level where there's a high risk of being exposed. This first block pretty much remains unchanged from the first two risk assessments. We started making changes in the second and the third block. Specifically, we said maximize telework to the fullest extent possible. We're going to continue to do maximizing telework. But we're going to add this: special accommodations will be approved on an individual basis to employees and or their family members, or who have family members with increased risk of severe illness and in accordance with OPM and HR guidelines. The employees will still maintain their social distancing to a maximum extent possible. However, we added only mission critical work employees and other employees experiencing an emergency should violate social distancing guidelines, and only when absolutely necessary for the mission success. Line officers, program managers, and supervisors will assist and support the maximization of social distancing by anticipating the decrease in productivity brought about by the implementation of social distancing, staggering and or adjusting work schedules, instituting virtual operations for customers. So now we went complete virtual as opposed to monitoring customers and visitors. Mandating all meetings be virtual or telephonic, eliminating all social gatherings, and accepting only necessary risk in relation to social distancing and in direct support of mission critical work. Line officers will establish screening procedures and for staff and visitors entering the building. With exception to mission critical work functions, vehicle usage will be limited to one employee per vehicle assigned to individual employees and prioritized to support mission critical work, regional priorities, or forest priorities. It is recommended that all employees wear a fabric or cloth mask while at work or out in the public for any reason. Travel outside the forest will be restricted to mission critical work, with exceptions made only by the forest supervisor. The PAO will ensure that the notices are published in accordance with normal procedures. We added these here also. Cleaning supplies and PPE purchase requests will be consolidated at the safety office. Safety manager will maintain an inventory of current supplies and prioritize distribution and use among mission critical functions and ROSO priorities. All purchase requests for cleaning supplies and PPE will be routed through the safety manager, who will then process the requisition. quarters will be prioritized according to mission critical functions, and forest supervisor will consider alternative housing solutions to include hotels or leases that are based on the current op tempo of fire and current fire season. Forest supervisor will consider the implementation of the use of POVs based on mileage reimbursements being approved at the current published rates. Employees acknowledge that the government retains no fiscal responsibility beyond mileage reimbursement, and the individual employees are approved by the FLT and employees supervisor. Cancels the individual prior to POV usage. The forest supervisor will consider the use of leased vehicles. Supervisors will contact their subordinates on a weekly basis at a minimum to ensure employees' well-being and to ensure that the employee is getting the support that they need. Supervisors will promote and encourage the use of employee assistance program. Staff will keep open lines of communication with their supervisors and subordinates and route concerns through available channels. Program managers, supervisors, employees will apply these forest operational risk mitigation procedures into their operations and daily activities. Those are our 3 risk assessments that are pretty much dictated and required because of the national strategic guidance that's provided to us, the 3 different levels of local community spread. Now, the intent for our forest is, once again, is to show that we're within the confines of the strategic and enterprise risk management, but then also to show where my forest supervisor currently is at. My forest supervisor is basically saying, here's my guidance, here's your operational confines, this is what you have to meet. That doesn't mean they can't further mitigate if they have the resources and the possibilities. What it means is, take this guidance, go and develop the risk assessments for your procedures and your operations, and just verify that they meet the confines of my risk assessment. So it's a tool that we're handing our employees to help them do risk management decision making. Where can I go from here? Are there any questions on the strategic level guidance that's been provided to us, the enterprise, the OSHA and the CDC guidance?
I had a couple come in over the chat line. This is Mike Peterson. One of the questions is, how is the local community transmission level determined, and how does this account for the lack of testing availability or testing lag time in the UP?
Okay, can of worms on that one, but I'll tell you right now, this I'll answer to the best of my abilities. This procedure is in effect right now. This is the national strategy, and it has been in effect since the evening of April 9th. It took a while to consolidate all this and get the picture going. Everything, it's been identified. The question really identifies that, where is the local community spread level being published? Well, right now it's not. So my recommendation is, even though we're required to operate by this strategy, because they're not publishing at the local level, your local community spreads, which will come through your Department of Health and Human Services, we are defaulting to operate at the substantial level, which is really what all forests have been operating at. And we're going to continue that way until they start publishing them. Now, in reading the Opening Up the U.S. Economy that was published last night, these levels of community spread are directly correlated to the phases for opening up the economy. To give you an example, we can't meet the substantial. We have to be at substantial when we start phase 1 of that opening the economy up. Phase 2 is equivalent to your minimal to moderate, and phase 3 of opening the economy is equivalent to your none to minimal. So I believe that at the end of no later than the end of this current national executive order, stay at home for 30 days, we will start seeing these published. Will it have a profound impact on us right away? It could, but I think most people will, they have to maintain the substantial for at least 14 days before they can start phase 1. And while they're in phase 1, they would still be in the substantial level. But what I'm trying to say is, this is controlled by the states and not a national publication. and the states have the ability to apply these levels as a whole to the state, or they have the ability to apply it to regions within their state. A good example, the state of Michigan, I believe there's 8 different regions. So they could have each region at a different level based off of how they wanna publish it. So there's not a solid answer to where you can find it, because you can't. But we fail safe and we default by staying in the substantial until they start telling us we can come down lower. Does that answer your question? Somebody might be on mute.
Looks like, yep, it looks like it got answered. And then the other question I had is about sharing this risk assessment. You know, obviously it's still a bit in draft form, not finalized yet. But either through yourself or Eric Swafford, you know, are they planning on, you know, getting copies of this out to the folks?
I don't know the answer. We're kind of taking a grassroots effort. Some people liked it and started sharing it with their organizations. So I'm willing to share it with anybody. You know, my goal is to have it approved by the end of the executive order, 30-day stay at home. My version will be tweaked a little bit in accordance with what my forest supervisor wants to go with, and how we and also the feedback we get from our program managers and supervisors as they're developing their risk assessments, because it will change. And I'll give you a good example. The good one is the thermometer that you guys were talking about earlier. If I don't need to implement the thermometer at the forest level, I don't think the cost basis is justifiable. We can take care of our screening through administrative purposes, especially at the moderate level, because we're going to screen people, asking them questions before they come in. At the substantial level, we shut down the office. It's virtual, so I don't have to worry about screening, and most people are teleworking, so I don't have to worry about screening employees and visitors. However, is it good to get one for fire? Fire's the area, or LEO is the area in the substantial level that holds the highest risk for violating the social distancing. They're essentially approved to do it. We acknowledge it might happen. We want to mitigate it to the risk, mitigate it to the lowest chance possible. But there's an extreme likelihood, especially in LEO and fire, that they're going to be operating within 6 feet of people. So would that thermometer be a good risk mitigating strategy? Absolutely, it is. Now, if we're not approved to use it, but we want to use it, say my fire crews came up and said, I need this resource, can you help us get it, or I need more PPE, then I can take their concern on their risk mitigation factor, and I can put it on my risk mitigating factor and saying, yes, we will resource these supplies. The forest supervisor agrees with your risk mitigating factor. We acknowledge that you need the resource, and we're willing to take that up, and we're gonna go with you. But now the forest supervisor would be the one assuming the responsibility to ensure that tool is resourced.
Thank you.
And I can share it. I'll if anybody wants. In fact, if I can figure out how to drop it on here, I will. If there's any other questions,
yeah, and that was part of the question too. Is you know, not knowing if this is a draft or it's going to change much, but being able to drop it into the chat was recommended, so so folks can kind of peel through a little bit on their own. A lot of verbiage there.
Yep, and I won't provide a signed copy, and that's because this is the risk mitigation for the Ottawa and the risk mitigation that my forest supervisor is willing to accept, and the guidelines that he's giving to his employees in his forest. But I can provide the unsigned version and editable version.
Yeah, that sounds great. Appreciate it. Looks like I got another question that came in. What are or should employees be operating under currently if this may not take effect or be signed until April 30th? And I think you may have captured that.
Yeah,
by
I did. So we have a current risk assessment that's approved. It was created prior to them publishing these April 9th. And it's still is it within the confines of the national strategy? The only difference is I didn't allocate for minimal to moderate and none to minimal. I just started creating those on the 9th because I saw it coming. I saw that we were going to be in 3 different phases. So I currently have a risk assessment that meets the substantial level, but in working with the forest supervisor, and my goal is I'm educating all forest employees on what the strategic guidance is, because that'll get buy-in, and that'll get clarity, and that'll get understanding on, if they understand what the national strategy is, when I provide the operational strategy and I brief this operational strategy and risk assessment to the employees, which I've already started doing, they're going out there with their program managers and supervisors right now, and they're already developing their risk assessments in accordance with the proposed guidance that the supervisors looking at signing. And as we further develop they're giving me more feedback on things that I might have to change on the operational level. This is a living document. That's what you guys, or correction, that's what everybody has to understand. Any risk assessment is a living document. The 5-step risk management process is a continuous process. So as we identify things that work or things that don't work, or if I get more tools in my belt like PPE, masks that I can hand out to everybody, I can change this and make it even more strict if I'm exposed to more tools or identify other hazards that we didn't think of. It's a continual process, and it has to continually be updated based off the changes in guidance, Forest Service policy, identified hazards, access to new, for instance, I don't need the masks right now. It's not required, it's only recommended. But I'll tell you what, if I had 5,000 of them and I made sure that all my employees had access to them, I would further mitigate it and say, and make the recommendation to the forest supervisor, hey, we have the masks, so let's make people wear masks, because that does mitigate to a certain extent.
Thank you. And like you'd mentioned before, we're essentially have been operating, as if it's substantial. So.
Yes, we have. Any other questions?
I don't have any more on the chat, I believe. Anyone else out there got a question? I will take that as a no. And yeah, I want to thank you very much for jumping on with us today, Noah. It's nice to see a little bit of that big picture perspective, and how it translates down to us on the ground. I think that was really, really helpful.
Sure. No problem. And I posted that risk assessment in the chat room.
Thank you.
Yes, sir.
Alrighty. Well, I will take the screen back, and we will move on to the next section.